Toula's Tips for Caregivers. Health is on the air with Toula Wooten, your source to go for resources and information to help you in this rewarding but sometimes challenging role. Toula's Tips for Caregivers is brought to you by Age Well Institute at Baptist Health, by Elmcroft Assisted Living and Memory Care. Now here's Toula.
Well, greetings everyone, and welcome again to Toula's Tips for Caregivers. As those of you who have been my loyal followers for so many years know, I am dedicated to caregivers, in particular, caregivers of our frail elders in our nation. I've been hosting this radio show for caregivers since 2010, and in that time I've come to know so many people, so many caregivers from across the nation who are giving their heart and soul taking care of their loved one. There are over 44 million of us in the United States, and I say us because I've been a caregiver for both of my parents for about the last 5 years, and I know firsthand the challenges it can bring. I also know firsthand the many joys and sweet memories that comes from taking care of someone you love so much. So I'm here weekly talking to you, the caregiver, to give you advice, support, tips on how to do this job better, but most importantly, tips on how to take care of yourself in the process, because we all know that so many caregivers die before the person they're taking care of, very often due to their own neglect of their own health care needs and just really not taking good care of themselves while they are so busy taking care of their loved one. Most of you also know that I work for our local nonprofit hospice here in Jacksonville, Florida, and today my topic is going to be how to avoid burnout when you're taking care of a loved one at end of life. And I'm really pleased to have with me today Dr. Sebastian Sepulveda. He's a doctor in Massachusetts, and he practices at Lowell General, actually in the same area my husband's from, and he believes that there's a better way to navigate end-of-life care. His specialty is in internal medicine, and he has over 17 years of treating inpatients as a hospitalist. He's very passionate about helping caregivers and helping families at end of life, as well as helping those who are dying. He's written a new book called At Death's Door, End-of-Life Stories from the Bedside, in which he talks about a lot of the experiences he's had helping people transition peacefully, comfortably onto the next life, as well as helping their family caregivers accept what's going through and supporting them. He received his medical degree from the University of Miami and his doctorate in medicine from the University of Chile. He has been a critical care medicine fellow. He's done nephrology at Duke University. He's been an associate professor of nephrology at the Medical College of Georgia, and as I said, now he's in Massachusetts practicing at Lowell General. So, Dr. Sepulveda, thank you again for being on my show today.
Thank you very much for having me.
I am really happy to have you, and if I just messed up your name, I'm going to ask you to forgive me at the onset, okay? Okay. Sepulveda, there we go.
Perfect.
Now I got it. It's really important to get a person's name right, and that's part of recognizing and honoring a person for who they are. And I do appreciate the work that you do with dying patients and their families. I know firsthand the challenges that can come from caring for a loved one through end of life. My own father died in the hospice program that I worked for just about 3 months ago. And I was really blessed to have had my dad in our hospice program to see firsthand the support and compassion and excellence in medical care he got, but also the support that I got as his daughter. So the work you do is really important. But, not everybody knows about end-of-life care and the best ways to go about it. What suggestions would you have for families to help them navigate the end-of-life process?
Well, I think the most important thing probably of all is to realize that you are dealing with the process of end-of-life. The definition of that period, if you will, can be a little bit foggy, But I also think that if you really have a good communication with your medical providers, they will let you know when the time for that period about stuff. And the reason to say that is the fact that many people don't even know that that's where they are. And as a result, some confusion happens.
Yeah, that's a really sad thing. I've encountered many patients in my work who really didn't know that they were at end of life, and sometimes family members who didn't want to tell them, wanted to keep them in the dark. What are your thoughts on that?
Well, my own experience is I think patients are quite aware of what end of life is, and I believe they know it. I also know that the families, as you put it, for whatever reason, they tend not to be in the same page with the patients, and that can generate some conflicts.
Yeah. It's really hard to accept that someone you love so much is entering end of life, is in the dying process. And I understand that from someone who loved my father so passionately. It was hard. It's the last thing you want. Yet if you can take yourself away from what you want and think about what they want and honor their wishes, it's the best situation for everyone, isn't it?
Correct. I think what happens realistically is the fact that the patients themselves realize how things are really going, and they tend to internalize that and run with it. And in my own experience, the patients themselves don't really fight that, but the families, I suppose, out of love, they can really become a little bit more difficult to deal with and have different expectations, and many times unrealistic expectations about prolonging life, which might make them put some of the patients through some unnecessary procedures and unnecessary options that do not really help the overall concept. So my own experience is families do have a hard time with that, and they can really make things sometimes unwillingly a little bit worse for the patient.
It is worse for the patient, and we all know that in America, so many physicians truly want to do the best for their patients, but many will extend procedure after procedure after procedure when they in fact know that this isn't really going to extend that person's life with any quality of life. It's a difficult situation for everyone. So how do you help these family members coming around to accept death as a natural part of life? It's the end of life. How do you help family members accept that?
Well, I think honesty from the physician is absolutely key. I don't think that as doctors we are all that honest with the patients in terms of telling them what we really think and believe. What our society does is always offers the patient another tray with 2 or 3 options they can take: surgery, chemotherapy, radiation, you name it. And when that fails, there is another tray that medical society, offers to the patients. And when the community hospital gets to the end of their possible treatments, the patient can get transferred to a tertiary care center where there's another tray of options. When realistically, in some of those cases, have we been really honest with the patient, and the patient be really honest with themselves as well as the families, and have a real clear-cut conversation about where things are, a lot of this could have been prevented.
And that's what we want. The bottom line is we are all going to die. At some point, we're going to have an end-of-life diagnosis, and we are all going to die. But the goal is for that transition to be full of compassion and excellence in care and transparency and family members coming together to talk openly about what's going on and help their loved one transition peacefully and with dignity to the next life. What are some practical options that you feel are available to patients and their families to make this happen?
Believe it or not, I think there is a significant element of simplicity behind this answer, which is it goes back to the honesty between the medical team and honesty from the patient and families to accept the unavoidable. Actually, one of the kind of funny things we said when writing my book was we should put somewhere in the book the line, everybody dies. And the reason is that whenever, especially families, face the unavoidable concept of end of life, it's like they never heard of it. And that creates a number of, as you put it, procedures and admissions and other things that complicate matters quite a bit. So in terms of options, I think that at a practical level, fortunately now we have the palliative care teams, which advocate for patients and families in terms of getting this dose of unfortunate reality and trying to make things a bit easier in terms of preventing procedures, admissions, and others that do not contribute to anything positive.
It doesn't really, a lot of those things that physicians often, a lot of those treatments that they keep doing that they know are futile, don't do anything to give the patient a better quality of life. And that's what we're aiming for, is a really good quality of life for whatever days you may have left. I think we've probably, and I'm sure you have too, read Toula Gawande's book, Being Mortal. He espoused the same sort of concept that we're talking about here, that in our healthcare system, we seem to overtreat and overtreat and overtreat, sometimes truly to the detriment of the patient. And I think what you kept saying was it all comes back to honesty between the patient, the physician, and the family. And sometimes that just means getting everybody together and having a really open conversation. Not easy to do in our society. In our society, we don't like to talk about death. But if we could approach it in that way so that everybody understands, I think you have a better chance of everybody being on the same page. For one thing, we all know that sometimes siblings disagree on how to treat or not treat parents, and we've all seen that over and over. And that's a really sad thing to see. And I'm sure you as a physician and involved with so many patients at end of life really advocate people putting their wishes in writing, living wills. Do you talk to your patients about that?
Correct. Well, you mentioned a number of things. I read the book, Being Mortal, and I think the value of it is the fact that it starts the dialogue.
Right.
Personally, I believe that that's the only value the book has, which is unbelievably important. Start the dialogue. What I do is a little bit different. I'm the specialist who, in the hospital, when the real end comes, has had to deal with these specific situations, the process itself and the death itself. So one thing is to talk about, the other is to be there and carry on the process. Right. And part of the process, as you put it, is hopefully educate the families, usually, and the patient in terms of getting them ready through documentation like wills or DNRs, forms that allow for the process to be more organized and simpler, and again, point towards preventing, especially futile things to happen to them, like operations with others.
Right. We both know how sad it is to see that happen, and working in healthcare for the number of years we have, we've both seen that happen. Do you believe there is a new approach to end-of-life care that we can have, and why? Why do we need it?
Well, I think we have an old and present end-of-life approach that is not working out, which is exactly the reason why I wrote my book. In other words, we have the misconception that we can live forever, which is not true, we have a misconception that coming to the hospital or going to a tertiary care center, it will give us life beyond what we are destined to have. And we believe that death is a failure, that death is unacceptable. And all of these concepts that are somehow wrong, the reality is that everybody, without exception, dies. And we need to be ready for, and we need to face it as a national phenomenon.
It is a national phenomenon, isn't it? In my work at Community Hospice, I found a quote a long time ago that I sometimes start off some of my presentations with, just because sometimes I feel like a little humor helps break the ice, and you can find humor in just about any topic. But the quote goes like this. The French think death is inevitable. The British think death is imminent. The Americans think death is optional.
Correct.
And it's true. We live in a death-denying society. It's hard for us Americans to do that, but to talk about death and to talk about it openly. We don't want it to be the conversation topic at every dinner, but to be able to get together with your family members and to say what you do and don't want when it's that time in your life is a natural thing. And the most important thing is that you want to be able to say what kinds of treatment you do and don't want. And you want to say that you want your family there, and you want that transition into the next life to be peaceful and full of compassion and care. And so that's our goal, isn't it?
Well, to complete the answer that, to the previous question, which this one is a continuation of, the reason why we need a new approach is because we need to do what you presented to us in the trilogy of death options. We need to realize that we are mortal, that this will happen, that needs to happen, in my opinion, with a little bit more dignity than what we do now. And unfortunately, a lot of the pain and suffering that goes into prolonging death process as opposed to extending life that we practice today through so many admissions procedures and that kind of thing can be simplified. And again, it goes back to the concept of honesty with the medical team.
Right.
If we, from a medical point of view, are honest enough with patients to let them know that the situation is over, they can take it from there. They can dignify their death. They can decrease their pain and suffering, and they can accept what is unavoidable.
Dr. Sepulveda, this show is for family caregivers. What advice would you have them hear from you today to help their loved ones avoid any prolonged suffering?
That's a quite broad-based question, and the answer is the following. It looks like I'm repeating myself here a little bit, but this is so important.
It is.
I think that one of the ways to decrease pain and suffering, which is what I advocate, is if you want to know and you know what's really going on with you and your loved ones, you should be looking at realistic options that refer a bit more to quality of life than extension of life.
Right.
And by doing that, there will be a lot of things that the patient will not have to go through, that will not prolong the dying process unnecessarily, and that will be more compassionate. And then, coming back to the, at a practical level, to the honest conversation with the primary care, with the oncologist or with the cardiologist, whatever the disease is, having, I would say, an early approach to palliative care, which I think can be very, very helpful guiding the process. And as soon as allowed and possible, with the hospice team, can really shorten the process itself and make it much more humane. And those teams are available through the hospital institutions, and people have access to that, and they are paid by insurance, and these teams can be very helpful. And when the patients get admitted to the hospital, if a clear-cut and honest approach is taken along the lines of end of life, the institutions are willing to be quite helpful. But when patients otherwise do the opposite and they are looking for major interventions, that kind of thing, that really prolongs the process and makes it harder on everybody.
Yeah, but harder on the patient and harder on the family members, because life is not meant to be prolonged at that stage. It's meant to take its natural course. So again, let's go back to the caregiver taking care of someone who has that end-of-life diagnosis, and you know that your loved one is going to be dying soon. How can you help those family caregivers avoid caregiver burnout, which is a very real phenomenon?
Specifically for the caregivers on the burnout, one of the things we know as a practical matter is that caring for somebody who's in the last stages of life, it can be very time-consuming. There is a lot of effort, there's a lot of work, there's a 24/7 type of situation. And at a practical level, what happened in our institution, for instance, is the fact that, as I said, through the teams of palliative care usually, and especially hospice, which gives a whole 6 months period, they can bring resources to the house, including nursing assistant visits on a regular basis. They can help the family with some other affairs, certainly caring for the patient themselves. And when the actual time comes of death, they come in, they pronounce, they prepare the body, they call the funeral home, and they make sure that that part of the events happens really uneventfully. That's the kind of thing that can be helpful, and the primary care doctors, through their offices, can certainly provide the families with some other resources along the lines of assistance, personal care attendants, and that kind of thing. So the PCPs can be involved and be quite helpful.
Hospices are wonderful when it comes to taking care of loved ones at end of life. As you stated, they provide nursing assistance, they provide nurses to do pain and symptom management, chaplains, social workers to make funeral arrangements if needed, and to help do some counseling. They provide so much support to the family. I know I often hear family members say, the one thing I wish is that I'd called sooner and had hospice come in sooner, because when hospice came in, I was finally able to take a deep breath and just not focus so much on the caregiving, but just be there for my mother, for my father, for my aunt or uncle, whoever. Just be there and spend quality time with them in their last days. That is precious, and that is one of the most important things I think that hospices provide, is just that relief, so that the family caregiver can know that the medical attention is happening. You need to just be there and be the family member now, because you can't get that time back, obviously. And it's a very precious time. I think it's a very sacred time. And I know in my own experience, I had a wonderful experience with the hospice organization that I work for, taking care of my father, especially in his last days. And I didn't have to do anything. I didn't have to be his caregiver anymore. I could just be his daughter and love him and kiss his forehead and tell him it's okay. Go on. It's okay. We're all going to be okay. And that's what you want, that loving transition for your loved ones. And I can't say enough about what hospice providers provide, and I know you just reiterated the same thing. Dr. Sepulveda, do you have any other words of wisdom for family caregivers? It's a challenging job, as you know.
Well, I think you said it yourself on the last your last sentences, which is the following: you went through this, and people do not feel their time is up. One mother, one father. So most people have no personal experience with the process. They never talked about. It gets them really by surprise. And as a result, they know nothing about it. They don't know what to do. The importance, that reiterates the importance of having talked about, having a plan, and being a little bit more knowledgeable because many people just go through the process really very ignorant about and helpless because it's not a public conversation. And there's such a little knowledge about it that when the time comes for everybody, it really, you are alone. So the only way to do better and have the experience, the type of experience that you have with your parents is to be knowledgeable about. Knowledge is power.
Yeah.
And so that's what we're trying to encourage. Have the conversation, know what you want, know what the plans are, be honest, and just face it for what it is. It's unavoidable.
It is unavoidable. As you said, it's the end of life. We're all going to die. The latest medical research shows that 100 of 100 people will eventually die, right?
That's correct. It hasn't changed.
It hasn't changed. It's never going to change. But our goal is to make it a transition that's as easy and painless as it can be for the family members as well as for the patient that's being cared for. And a lot of it goes back to the things that you talked about, which is honest, open conversations between the medical providers, the family, all together, coming together to decide what needs to be done. And when you have those conversations, the chances of it happening that way are so much better for your loved one. This is an important topic. You and I could probably talk about it for days if you want to know the truth, because I can tell you're as passionate about it as I am. I hope I get to meet you someday. I do go to Massachusetts every now and then to see my husband's family. So
that would be great.
I would love to meet you.
How easy to find?
Yeah, I know where you practice now, and he knows too. So I will come meet you. You have been a wonderful guest on my radio show today.
Thank you very much.
Thank you for your passion and for your care for people at end of life. And I know I'll reach out and get your book. So thank you for what you do. You've been listening to Toula's Tips for Caregivers. Caregivers, again, I always end my show with, please take care of yourself. You can't pour from an empty cup. Fill your cup. Take care of yourself so that you can take care of your loved one. And you can be strong and healthy when the caregiving ends. I wish you all many, many blessings.
Hi, this is Toula, and I'm here to talk to you about Baptist's new Age Well Institute. Are you caring for a loved one who's 65 or older? Are you a boomer like myself who's caring for a parent? And perhaps your parent has been experiencing some decline in their overall health. Let me highly recommend to you the Baptist Age Well Institute. They have the only real geriatrician here in Northeast Florida who is able to look at the whole person. Their comprehensive approach includes a nurse, a doctor, a social worker, a pharmacist, a dietitian. They have their own physical therapy there. They can work with folks with memory disorders. My goal is to help you, the caregiver, find an organization that can care for your loved one who's 65 or older. I take my own parents there, and I highly recommend the Age Well Institute at Baptist. Please give them a call at 904-202-4243. Again, that's 904-202-4243. You'll be so glad you did.
Have you read the new book, Love Stories and Timeless Tips yet? It's by our own Toula Wooten with Toula's Tips for Caregivers. Toula is a caregiver, too, as well as an expert on caregiving. You can get it in paperback or on Kindle at Amazon.com. The book is filled with touching stories of caregivers taking care of their loved ones. Each chapter has helpful ideas that we all can use. I love that Toula included a Toula's tip with each story. Her message to caregivers is clear. Take care of yourself so that you can take care of your loved one. This is a beautiful book for all caregivers to read, whether you're a part-time, full-time, or long-distance caregiver, or someone receiving care. You should get the book today. Just go to Amazon.com, search for Love Stories and Timeless Tips by Toula Wooten.